Hi, this is Mark Harris at Cobble Creek Dental in North Ogden. I wanted to talk just for a minute today about something that's come up a lot lately here at the office, and that's having a dry mouth. We have a lot of patients that have a dry mouth, and I've been asked a lot about that lately, so I wanted to answer that. First of all, what's important about saliva or spit? Well, it serves a lot of important functions for us. One of those is to buffer the acids in our mouth so that we don't get cavities as easily. When we consume sugars and starches in our foods, the bacteria that naturally live in our mouth convert those things to acid, and without enough saliva you'll get cavities a lot more. Another important function is it serves as a lubricant for the insides of your lips and cheeks and your throat. As you chew food, you need that saliva in order to make something that you can swallow. Without enough saliva, especially with dry or spicy foods, it can be difficult to eat and swallow. It can be difficult to talk. It can also wake you up at the night just with a dry mouth. It can be very sore. You can develop ulcers inside the insides of your cheeks. You can sometimes appear to have a pebbly surface to your tongue, and it can be sticky inside your mouth. Consequently, bacteria tend to not be washed away as easily, and you have more bacteria, bad breath, and a number of other things. So it's important to have enough saliva. A lot of things cut down our saliva flow. Medications is one of the prime suspects. Some of our patients are on multiple medications. The more medications that you're on, the more likely you'll have a dry mouth, because it's difficult almost to find a medication that doesn't cause dry mouth. But some of the worst offenders are antihistamines and allergy medications this time of year. Also antidepressants and various blood pressure medications and so on. There's just lots of medications that do this. Also, some conditions, some medical conditions such as Sjogren syndrome, which is an autoimmune disease that attacks saliva glands and tear ducts, or tear glands, can decrease your saliva flow. So it's important not only to talk to your doctor and dentist to find out why you have a dry mouth, but also to how to treat it. There's a number of remedies you can get over the counter, such as biotene. It has a number of different rinses and sprays that can help to lubricate and relieve the symptoms of your mouth. Sugar-free lozenges, it's important that they're sugar-free, but those can help to stimulate saliva flow. One of the best ones that I've come across lately is called xylmelts. Starts with an X, I'll write it down below. You can get that from Amazon.com, I believe, or orahealth.com, and they just adhere to the insides of your cheeks or gums, and they work wonderfully. A lot of our patients give us good feedback on xylmelts. If it's severe, sometimes we'll prescribe a pill that you can take 3 or 4 times a day that stimulates saliva flow. And of course we want to look carefully at the effects of that medication in conjunction with your other medications or conditions that you may have. But it's not something that you should live with. You should get it taken care of and looked at and treated as much as possible. It's a frustrating condition. But if you have any questions about this, give us a call, or any other questions, give us a call or an email, or write us a note on our Facebook page. We like to answer questions in the form of a video sometimes. Hopefully this helps. Have a great day.